When they give you a patient, all you care about is the patient have a breathing problem, which can be pulmonary edema, pneumothorax, DVT, or electrolyte problem, shock, sepsis, or the hypothermia or hypoglycemia. A high sugar does not matter. You want a very low sugar, hypoglycemia. Or did they have an airway problem or neuro problem or pain? Not every pain is a problem, but pain that is life, limb, and eyesight. But what is this? This is just a bunch of buzzwords. I call them buzzwords. So when you see them, they should be buzzing in your ear. And so if you have like a second, who do you want to see? That's this is about, right? Prioritization 101. Therefore, let's look at some questions and we're going to apply. So every time they give you a question, ask yourself, if I have 1 second, who do I want to give that second to? What does that mean? You have to take care of the breathing problem. You got to take care of electrolyte problem. You got to take care of shock and sepsis. You got to take care of hypoglycemia, hypothermia. You have to worry about airway issue. You have to worry about neurological issue, and you have to worry about pain. Do you have any orders? Of course, this is always number one. But you have 1 second. After you select the airway, who do you think you should worry about? You don't need to do ABC. You just have to look at it and say, who is sick? COPD patient, clapping of the fingers with the pursed lip when he's walking. CHF patient, severe leg edema. Asthma patient who is wheezing in all lung fields. And a COPD patient with the barrel chest, decreased breath sound on the right. This is prioritization 101, right? So who do you want to see? COPD patient with the pursed lip when walking, CHF patient with the severe edema, asthma patient with the wheezing, and the sides of that, and the COPD patient with the barrel chest and a decreased breath sound on the right side. Prioritization 101. Who do you think is dangerous? This is an expected finding. If you have COPD, you get clapping of the fingers. When you're walking, you use pursed lip. This is how I explain prioritization to you. It's an expected finding. Therefore, you should not even think about it. CHF patient, I should see what? Edema. When this become a priority, pink, fruity sputum. That means they have pulmonary edema. This patient does not have that. So don't worry about it. Asthma patient who is wheezing in all lung field, an asthma patient will never stop wheezing, okay? And he's wheezing in all lung fields. Everywhere is wheezing, and his SAT is 92. You can't get anything better than that. You can't get anything better than that. So don't worry about it. COPD patient, barrel chest. This is the buzzword I want you to pay attention. When I say buzzwords, this is the thing I'm talking about. As you study, you hear it, COPD buzzword, I hear barrel chest, I know what is the diagnosis. You see those two words? I know that this patient has emphysema. What are the complications of emphysema? They have blurbs. They are long, it's big, long and big, right? It's elongated, and they have balloon blurbs. These blurbs can what? Can perforate or rupture, and they will develop what? Pneumothorax. That's why he has decreased breath sound on the right. This patient has pneumothorax. Be sharp, but not be expected. COPD patients should have a clapping of the fingers, and when they walk, they should use pursed lip. That is what? Emphysema patient is using pursed lip to walk. CHF patient expect leg edema, right? Asthma patient, I expect you to be wheezing when you have acute attack in all lung fields. A COPD patient with the barrel chest, that is a buzzword. And what does it tell you? It tells you that this patient has emphysema. What are the bad things you should worry about emphysema? You have 1 second, is blood rupture. It sees all content. And if you rupture, what does that happen? Pneumothorax. And what do you see? Decreased breath sound on the left side. And what does that mean? You're looking for a breathing, electrolyte shock, airway, lethargy. Is there any breathing problem here? Is there any electrolyte issue here? Is there any shock patient here? Is there any hypothermia patient here? Is there any pain patient here you got to worry about? Is there a neurological problem? I see a breathing problem here, right? I see a breathing problem here. I don't see electrolyte then. I see a shock patient. This is a shock patient, right? I see a sepsis patient. I see a pain issue here. I see a what? Airway issue here. No, right? So those are the things you do. Now, let's look at the question now. Let's look at it. Let's look at it carefully. If you selected your answers, think about it before you select it. Look at it. If you have CHF and you have BMP of 1,000, it's an expected finding. You don't have, that is the diagnosis of BMP, CHF greater than 100. The number does not matter. Therefore, this is not your problem. It's not your problem. I have pneumonia. What should I expect in the patient who has pneumonia? It should have a temperature of 103. It should have reproductive cough. Does this surprises you at all? If it does not, then let it go. Don't even pick it. That is what prioritization. If it surprises you, then you got to be sharp about thinking about and picking that one. If you have pneumonia, your temperature is going to be this. I don't know, and you have productive cough. Hey, hallelujah. Good luck with that. I have 1 second. I'm not going to give it to you. Pericarditis, I see a JVD and a narrow pulse pressure. That is not what I expect in somebody with pericarditis. What do you expect with somebody with pericarditis? Okay. And this pain is a friction rub. It's relieved, okay? They're going to have chest pain and it's relieved by leaning forward. That is what I expect. What happens? When the heart is constricted, it's constricted by the inflammation or whatever is causing the pericarditis, they develop what? Tamponade, constrictive pericarditis. Therefore, the heart cannot pump. It has signs and symptoms of what? Cardiac tamponade. So you see a JVD and a narrow pulse pressure. Narrow pulse pressure means your blood pressure is 120 over 110. This is not normal. I will take 90 over 50 than over this one. If your blood pressure is 90 over 50, you're doing better than somebody whose blood pressure is 120 over 110. That means the heart is not pumping. That is what? Narrow pulse pressure. Diverticulitis. I see anheitis. I see infection here. You're going to have pain. Itis give you pain. Itis give you white count. Why would you pick that one? It's an expected finding. Just let it go. Don't even think about it. So, number 3 surprises me more. And if I choose that, I'm being sharp. Why? Because I see shock and sepsis here, right? I see sepsis here, but this shock is dangerous, right? I see a breathing problem here, but this patient, I've not told you his SATs is dropping or anything like that. This is how you do prioritization. Answering because it's a legitimate question to be asked. It's a content-based question. Urinary agency, you know about that, and frequency. Then I have severe suprapubic pain. It's a diagnosis of something. Abdominal pain, I have guarding and rebound tenderness. It's a diagnosis of something. Diagnose all these problems and say, hey, which one is dangerous? Nephrolithiasis, severe frank pain. If I draw the kidney to you, the kidney is on your right side and the left side on the back, and it go into your bladder. When you have pain, it's going to follow the pathway to the groin. You're having kidney stone. That is classic definition of kidney stone. Does kidney stone bother you? Is the diagnosis of it. If you have pain here, right lower quadrant pain, let me draw that one too to you. Right, this is the belly button. This is your spine. Right lower quadrant pain, 2/3 of that. You have pain here, and your white candle is 20,000. This is appendicitis. That this surprises you based on what I've done. Urgency, frequency, severe pain, suprapubic here. This is what? Cystitis. You see now, you can see the picture what I've done, and I have abdominal pain, rebound, tenderness. You have peritonitis. Tell me who need a second. If you have a second, who do you want to give it to? Somebody with cystitis, somebody with appendicitis, kidney stone, and that. These are all definition of kidney stone. There's no surprise thing in it. Right lower quadrant pain, white count of 20,000 McBenney's. There's no surprise thing. It's appendicitis. It's not dying. Cystitis, some bladder infection. This guy has peritonitis, bad infection. And do you see it here? Sepsis, right there. Of course, cystitis can get sepsis. Appendicitis can get sepsis. You see what I'm trying to do? I'm trying to let you think. You can have a bunch of sepsis, but you have to look at the diagnosis and say, hey, appendicitis is also sepsis. Cystitis can develop sepsis. Kidney stone can develop sepsis. Like they all can give you sepsis, but whose sepsis is more dangerous? Who has no time that you need to fix it? You know, peritonitis sepsis is dangerous. It's already perforated, whatever is causing the sepsis, and you got to be sharp and work faster and fix it. Boy, that's our boy. So which one do you think is more dangerous? Who do you want to see? Who is a priority patient? Who need to be seen? Think about it. Let's get to it. Did you figure it out? First patient. Number two, let's start with number two. Severe back, spine surgery. There's something wrong with the spine. You see, that's the bad word. He has severe, that is distract word, right? Lower back pain radiating to the foot. This is sciatica, right? That is why he's getting surgery. That's not the problem, right? It's not a problem. 2 days peritoneal dialysis. Effluent is pink, tanked, and it's cramps. Probably he's getting cramps. He's going too fast. 2 days, 1 to 2 days, you should expect some pain output from peritoneal dialysis. This person is no problem. The kidney, like I draw for you, the kidney is on your back. When we have to do biopsy, you are on your front, so prone position. And then we biopsy here. After biopsy, you got to put pressure on it. You have to put pressure on a kidney. How do you put pressure? You put them on their back. Back is supine. This patient at biopsy is in a supine position. After the procedure, is good. His heart rate is 75, is good. There's nothing you can do for this patient that is not being done. Correct position post biopsy on the right side is wrong. They have to be on their back, supine. Supine to put pressure on it. The liver, yes, on the right side, but kidney, you need to lay on your back to put pressure. Pressure on the kidney is on your back. The kidney is not on your right. The kidney is on your back. So after biopsy, you have to put it on your back. Pay attention. The liver is on your right side. So yeah, liver, you put them on the right. The kidney, they need to be supine. So this patient is supine, is doing fine. His heart rate is 75, is doing good. Don't worry about it. You have to know what this is. College or high school students, sore throat, pharyngitis, Baswed. When I say Baswed, I mean Baswed, okay? If I give you a case, this is the way I will say it, and I'll to distract you. But the key word is high school, college student with the sore throat that went out partying. He went and kissed the girlfriend. And then he has what? Kissing disease. This is mononucleosis. What is the biggest problem of mononucleosis? Is going to have liver and spleen get bigger. The liver and the spleen get bigger and bigger and bigger. And this is going to perforate. So if he's having left upper quadrant, that's where the spleen is located. It's going to perforate. That's your priority. Hemorrhage. This is hemorrhage. But this is where BESHARP is. If you know your content, you say, you make a diagnosis, sore throat, partying, he has mononucleosis, he has left upper quadrant, he's probably having bleeding, he's shock. So this patient is in shock. That's your priority, and that is the BESHARP. It's mononucleosis with the sharp, and therefore you have to see him. That is, I say, Baswed. Know your Baswed, and this will be easy. So the right answer is that guy.